Coming to nucleotide metabolism, here we'll see about purine salvage pathway. So in the degradation of nucleotides, free purines are formed. So those free purines they are recycled by a pathway called as salvage pathway. So we call it as purine salvage pathway. It is concerned with the recycling of free purines formed during the degradation of nucleotides. Right? So that's about this. That's what happens in case of purine salvage pathway. So here we have three purines: adenine, guanine, and hypoxanthine. They are recycled. They are converted to corresponding nucleoside phosphates. Like when you see adenine is converted into AMP by the action of enzyme called as APRT, adenine phosphoribosyl transferase. So here it requires the PRPP. So adenine is converted into AMP. In the same way, guanine by the action of enzyme called as hypoxanthine guanine phosphoribosyl transferase, call it as HGPRT, and this also requires PRPP, and guanine is converted into corresponding nucleotide guanosine monophosphate. Same way, hypoxanthine by the action of enzyme called as hypoxanthine guanine phosphoribosyl transferase is converted into inosine monophosphate. So this is how free purines, adenine, guanine, and inosine, they are converted into corresponding nucleotides by action of enzymes called as adenine phosphoribose transferase in case of adenine, and in case of guanine and hypoxanthine, it is hypoxanthine guanine phosphoribosyl transferase. So simply, whatever the purines which are formed by the degradation of nucleotides, they can be converted into corresponding nucleotides. Right. So that is what happens in case of salvage pathway. Coming to significance of pathway. So what is the significance of this pathway? Actually, for the synthesis of purines, we have to invest a lot of energy. So that is a complicated process. So in order to conserve that one energy, so we use this energetically, very less energetically required process, that is purine salvage pathway. When you see de novo synthesis of purines, it is a costly process. We require to invest more amount of energy in case of de novo synthesis. So by this pathway, we can save that energy by recycling those free purines, right? And coming to this is most important in brain and erythrocytes where de novo synthesis of fatty acids cannot occur. So that's why this is important in these two tissues, brain and erythrocytes, right? So this is about the significance of purine salvage pathway, right? So one is reducing the requirement of costly energy, costly process, and the most important tissues, brain and erythrocyte, they can depend only on this particular process. Coming to regulation, how this purine salvage pathway is regulated, and that is regulated. So HGPRT is regulated by IMP and GMP. Whenever the concentration of IMP and GMP is more, they inhibit the HGPRT. Same way, AMP inhibits APRT, adenine phosphoribosyl transferase. This is how purine salvage is regulated. And coming to degradation of nucleotides, degradation of purines, how these purines are degraded. So end product of purine catabolism is uric acid. Whenever a purine undergoes catabolism, the end product you get is uric acid. So that way, so uric acid is called as end product of purine catabolism. And when you see, so AMP, IMP, and GMP, so they can be converted into uric acid when they undergo their catabolism. For example, when you see adenosine monophosphate by the action of enzyme called as AMP deaminase, it is converted into inosine monophosphate. So that inosine monophosphate in the next reaction catalyzed by enzyme called as monophosphomonoesterase, the phosphate is removed, so that is converted into inosine. And that inosine by the action of enzyme called as PNP, right? So that is converted into hypoxanthine. Hypoxanthine in the next reaction catalyzed by the enzyme called as xanthine oxidase is converted into xanthine, and again in the next reaction catalyzed by the same enzyme xanthine oxidase, xanthine is converted into uric acid. So uric acid is a 2,6-trioxypurine. So that is the nothing but uric acid. So this is about the AMP, adenosine monophosphate, and when you take Adenosine. So adenosine by the action of enzyme called as adenosine deaminase is converted into corresponding urine, that is inosine, and that inosine undergoes same set of reactions catalyzed by the enzyme called as PNP, xanthine oxidase, and finally converted into uric acid. And when you see in case of guanine by the action of enzyme guanine or guanosine, so that guanosine by the action of enzyme called as PNP, it is converted into guanine, and guanine by the action of enzyme called as guanase, the amino group is removed from that guanine, and guanine is converted into xanthine. Xanthine by the action of enzyme called as xanthine oxidase is converted into uric acid. So when you take AMP, adenosine and guanosine, the end product in case of these two purines is uric acid. So uric acid is a 2,6-A-trioxypurine, and the most important enzyme in case of purine catabolism is xanthine oxidase. So there are some drugs which decrease the activity of this xanthine oxidase. So those are used in the treatment of a condition called as gout. And what is gout? So gout is a clinical condition in which there is accumulation of uric acid in the joints, and that leads to acute arthritis. So that is what happens in case of gout. There is accumulation of uric acid, mainly in the form of monosodium urate. And this uric acid mainly deposits in the cooler areas of the body. So that is the significance of gout, accumulation of uric acid in the cooler areas of the body, and that mainly results in mainly in case of joint, and that results in the condition called as arthritis. So such type of arthritis we call it as gouty arthritis. So what happens to serum uric acid levels in the gout? So gout is because of hyperuricemia, means increased uric acid levels in the blood. So normal concentration of uric acid is 3 to 7 milligrams per deciliter. So this is normal concentration, and whenever it is there hyperuricemia more than this normal range, we call it as hyperuricemia, and that excess uric acid gets deposited in the joints. So that is what happens in case of hyperuricemia, that results in the gout. So we have two types of gout: primary gout, secondary gout. Right? So we'll see what is primary gout and secondary gout. So primary gout is mainly because of excessive synthesis of purines. So there is all those reasons which results in the excessive synthesis of purines. So we call that results in the gout. We call that condition as primary gout. So excessive synthesis of purines results in a type of gout is called as primary gout. So what causes primary gout? So the abnormal 5-phosphoribosyl amidotransferase. So whenever there is an abnormal type of this enzyme is there, this enzyme cannot be regulated by feedback regulation. So it is not sensitive to the feedback regulation. There is continuous activity of this particular enzyme leads to increased synthesis of purines. So whenever there is increased synthesis of purines is there, those are subjected to increased catabolism, and the end product of purine catabolism is uric acid. So it results in the increased synthesis of uric acids, and that finally leads to gout, and that we call it as primary gout. The same way occurs in case of abnormal PRPP synthetase and deficiency of enzymes of salvage pathway. So whenever there is deficiency of enzymes of salvage pathway like APRT, adenine phosphoribosyl transferase, and hypoxanthine guanine phosphoribosyl transferase, then free purines cannot be recycled, and those free purines are subjected to catabolism, and increased catabolism of free purines leads to increased uric acid. Right? So, and the other reason is, and whenever those PRPP is available in more amount, because it cannot be utilized in the salvage pathway, and that can be used again in the synthesis of purines by de novo synthesis of purines. Right? So that's how it leads to increased increased purine synthesis, and that results in a condition called as primary gout. So what is secondary gout? So there is increased purine turnover, right? And that is seen mainly in case of conditions like there is increased uric acid production in case of increased uric acid production in case of secondary gout, and that is seen mainly in case of conditions like polycythemia, leukemia, right, lymphomas. In all those conditions there is increased nucleic acid turnover nucleotide turnover is there. That nucleotide turnover results in the increased production of uric acids. Right? So there is increased degradation of nucleotides, and that increased nucleotides they result in this synthesis of excess amount of uric acid. So that's how. So there is increased production of uric acid results in the secondary gout. That is one reason, and the other reason is reduced excretion of uric acid. So one condition is increased production or synthesis of uric acid, and the other one is reduced excretion of. Whenever there is failure in the excretion of uric acid, that results in the increased levels of uric acid in the blood, and that leads to condition called as again it leads to secondary gout. So what causes reduced excretion of uric acid? So here the reason is whenever there is renal failure and whenever there is treatment with some diuretics called as thiazide diuretics, it leads to decreased excretion of uric acid, and that leads to increased accumulation of uric acid. Right? So these are the main reasons which results in the decreased excretion of uric acid and increased production of uric acid, and together it leads to a condition called as secondary gout. Yeah. So, gout is two types. One is primary gout, secondary gout. Primary gout is mainly because of increased purine synthesis. Secondary gout is mainly because of increased turnover of purines. Right? So that's the main reason behind primary and secondary gout. Now coming to what are the features of gout? What happens in case of gout? So the important features are gouty arthritis. Mainly it gets deposited in the joints and it leads to arthritis. So such type of arthritis we call it as gouty arthritis. So apart from that there is nephropathy. So this uric acid gets deposited in the nephrons and it affects the nephrons, and that condition we call it as nephropathy. And these crystals, when you observe under microscope, so we can see uric acid crystals, those birefringent urate crystals can be seen in the synovial fluid. That is one more important feature of gout. And coming to tophi, so that gets deposited in the joints, though that leads to swelling of the joints. So that condition we call it as tophi. So tophi is the important characteristic feature of gout, because so there is a deposition of uric acid in the joints. So that is called as, that leads to swelling. So that swelling of joints because of deposition of uric acid is called as tophi. So that is one most important feature of gout. Coming to treatment, how you treat these cases, gout cases. So these gout cases can be treated. So in this treatment, so we have to decrease the formation of uric acid. So uric acid is formed whenever purines are degraded. So we have to decrease the degradation of uric acid so that uric acid formation can be decreased. So here the enzyme xanthine oxidase is inhibited by some drugs like allopurinol. So that allopurinol competitively inhibits the xanthine oxidase and it leads to decreased activity of xanthine oxidase. So that is mainly involved in the synthesis of uric acids. So whenever the activity of uric acid is decreased, then the formation of uric acid decreases, so we can decrease the levels of uric acid in such cases. So that is one way, and you can increase the excretion of uric acid, renal excretion, and that is brought by some drugs called as uricosuric drugs. So their main function is they increase the excretion of uric acid. And in case of gout, there is increased inflammation. So that inflammation can be treated by a drug called as colchicine. So that colchicine is an anti-inflammatory drug that is also used in case of gout. So this is how we can treat the gout, by decreasing the synthesis of uric acid, by increasing their excretion, and that inflammatory condition is treated by using a drug called as colchicine. So till now we discussed about how purines are synthesized, recycled by purine salvage pathway. So what happens whenever the concentration of this purines is more, and what are the important types of gout, and what is the treatment of